and first of all, encourage you that the MTUS is excellent. A lot of people have concerns about it, but in any discipline that we have here, we practice evidence-based medicine. We run around, get online, we get our journals, we go to conferences, and we're constantly trying to keep up with it. I had a friend of mine years ago saying, hey, have you seen the MTUS? Keeping in mind that I practiced workers' comp for many years. And I said, no. I go online, I look at the MTUS, and frankly it was a little boring, but I thought it was very fascinating, and we got together, 20 or so professionals, and they wrote down, they were doing the work for me. They were doing all the evidence-based, let's go out and look all this stuff out there, and it helped me immensely. I know that, we're doing this, it was initially started for one really basic reason, and that is to cut healthcare costs, improve functionality, et cetera, all the ramifications that come from that. If we do properly implement the MTUS, people do actually follow it, the majority of cases will be taken care of in a timely fashion. The problem that we have is that it doesn't happen. And there are a few situations like some of the people have mentioned that, they're complicated clinically, etc. You got to try to figure it out. It's not easy. But we got a real problem going on here, I think, in workers' comp. And the MTUS was an effort to correct that. The MTUS was put together and to be administered in a timely, integrated, multimodal approach. The MTUS is intended to provide the most current and effective medical care for workers' compensation patients. You have to keep in mind something. If I'm a pain specialist, even with a pain patient, I walk next door and I take care of a patient, a workers' comp patient with a rotator cuff tear, and then I walk right next door to the next room and I see a rape or a pain patient that's not workers' comp, and he's got a rotator cuff tear. That MTUS information bleeds over into my practice. So the standards that you create here have big, long, reaching fingers that affect the care throughout California. And I know personally many other states follow the MTUS. The MTUS makes statements like the providers are required to follow it. It is the authority. And in fact, in general, I think it's very good, spot on. The problem that we have, here's the problem, at least as far as I can see, is insurance carriers are not required to know or implement the MTUS. This is what I run into every day. The state does not require insurance companies to even acknowledge the MTUS. If you're an insurance company, you want to provide workers' comp, then you apply to the state, you get your certificate, but there's nothing there saying that you at least acknowledge or read the MTUS. Providers that get on NPM lists or the insurance companies, they are not required to read or even acknowledge the MTUS. I'm not talking about running around policing everybody, but last year, prescription overdose meeting that they had formed up here, I came up here and I talked, and there had to be 400 to 600 people there, including the board. And I asked them all, insurance companies, representatives, providers, etc., board members, leaders in the medical field here in the state of California. One person raised his hand and said he knew about the MTUS. I run into this all the time. Third-party payers, same thing. They're not required to state that they've looked at or read or even know about or acknowledged the MTUS. This MTUS is simply not implemented to establish the standard of care provided. It's not. But instead, is used to litigate care that's already been provided. It's a retrospect. It's not setting up what it intended to do. And the consequences of that is the workers' comp system has grown into a multi-billion-dollar industry, frequently abused and misused, often fraudulently. Excuse me. Insurance companies regularly refuse or deny provider requests as a matter of course, regardless if the request follows the MTUS. I'll cut and paste the MTUS and send it in as a request. And they'll write back and say no. And instead of doing it in 5 days, it'll take them 10 days, and then it'll go to UR, and everything is fractionated. You can see that. Exactly what happens. Utilization review and independent medical reviewers, they don't follow the MTUS. Seldom have I ever talked to them. I talk to them and then tell me straight up, I don't follow the MTUS, I follow APOM. It's a law. Why don't they? Why don't they know? So that's my question. So, what else happens because of that? Most providers don't even know what the MTUS is, nor are they expected to by the insurance company. In fact, it's financially probably more profitable for them not to know the MTUS. The MTUS will as quickly as possible, bring a patient all the way to his PNS, most functional state. But if I keep the patient for years, what's the average time for a workman comp case in California? That's what, 1.5 years. The MTUS, and just my simple logic, if I broke my legs and I was fed yogurt, Mother Nature would heal me in 3 months. We got a problem. And all these fine-tunings, they're good. Everything you're doing is good. But there's a bigger problem out there. And that's that people are not aware they need to follow or be aware of the insurance. It's just that simple. Not requiring insurance companies and their providers to follow the MTUS has divided, in my mind, the workman comp industry. Financially relegating each party to their own adversarial position. Insurance companies fight with doctors fight with the insurance companies, with UR, everybody's back and forth. And who gets hurt from this? The state taxpayer and the patient. Patients suffer more and longer disability claims soar. Loss of production and decreased functionality ensues. Costs rise, just from that simple fractionation. Addiction, we all know about prescription overdose. It's the big household term these days. Addiction and physical dependence is created in workman comp patients. Patients are required to comply with workman comp rules, so they have to come see me once a month. Right? And when I get delayed, denied, I'm sitting in front of the patient next month, I can't do anything for him except give him narcotics, help him with his pain. Either that, or I'm a pretty cruel man. Now you're out in the case a 1.5 years later, and you wonder why the person's addicted to narcotics. They're not following. It doesn't written. Nobody's talking about it. We're not on the same page. I believe the solution to this is not a Gestapo approach, not the government stepping in and shoving medical care rules down our throats. That's not right. But the MTUS is written by our peers. And if anybody knows anything about pain management, it's good. And this is not rocket science here. So why don't we? Please. That's why I drove all the way up here with the runny nose and cough, etc. Just ask you if I have one opportunity. Please, just put a sentence in the MTUS that says doctors that want to be on a provider network should have to acknowledge that they will follow the MTUS. Simple. Insurance carriers and TPAs that want to provide workers' comp, they should have to acknowledge that they will follow the MTUS. Now you've taken that fractionation and put it together. Now we have changed our perspective. And that we seek first to use the MTUS to establish the standard of care we provide. Then, when necessary, we use it as a measure of that care. It's very simple. It's the law, you've written it, and it works as intended if you get the providers and the insurance companies to at least acknowledge that it exists.